Good afternoon. Welcome to your favorite program, Blood Talks, the science of what flows through you. For a while now, we'll be looking at sickle cell disease and looking at certain challenges that are very common among a couple giving birth to babies with sickle cell disease. Now, today we'll be looking at sickle cell crisis. You may have sickle cell disease, or you may have a brother or sister, a cousin, a niece, an aunt, a brother, an uncle with sickle cell disease, and you know that you've been spending money. Most times go to the hospital, they are giving blood transfusion, they are treating infections, and yet it seems to be a very frequent recurring issue. Today we'll be looking at why do people have different level of crisis and they are all sickle cell. Some people have sickle cell disease and they do not have frequent crisis. And why is it that some have sickle cell disease and they are always coming down almost every month with crisis? Yes, I like to inform you that some individuals, if you look at the profile of their hemoglobin, the hemoglobin that they have as fetus, which I discussed with you in the last episode, the fetal hemoglobin, usually reduces at the end of 5th to 6th month. Now, some individuals have levels of the hemoglobin F sustained beyond 6 months. So they now have a mixture of hemoglobin F along with the hemoglobin S. Rather than 1%, they have well above 2-3% of their blood being hemoglobin F. So this hemoglobin F compensates for the presence of the hemoglobin S so that they do not come down with frequent crises like those who do not have levels of hemoglobin F that can sustain them. Most times, if you do your hemoglobin quantification, you will find out that the level of hemoglobin F for these people that do not have crisis are usually above 2%. Now, for those who have frequent crisis, most times the hemoglobin F is below 1%. So, the higher the hemoglobin F level, the more likely you are not going to be having frequent crisis. And you know that crisis can be caused by frequent infection. And you know we are in malaria endemic zone in Africa where people usually come down with malaria almost every time, typhoid infections. Now, the more you are able to avoid infections, the less likely you are going to have crisis. And then avoid stress. All this we all know. But there are certain things you do not know. There are certain secrets, or should I say, there are certain ways that we have adopted to actually reduce. So if you know somebody who has reduced frequency and increased frequency of sickle cell crisis, there are ways that we can actually reduce the frequency of this crisis so that you can spend less time in the hospital and less money. Now let me give you one or two, and then there are certain things we cannot discuss on the scope of this program, but you can reach to me for details of these things later after the show. So when you have a crisis, please consult the hematologist. Okay? You are covered. Thank you for listening, and we'll be expecting your questions. Putting your questions in the question box, and then you can give us a call or send us messages. Thank you.